Have you ever noticed that Black women are often expected to choose just one explanation for what we're experiencing? Is it race? Is it gender? Is it income? Is it where you live? The problem is that life doesn't work that way, and neither does health. So let's talk about it. Hey, I'm Dr. Lakeisha Watson, epidemiologist and data storyteller, translating data into public health insights for Black women. Welcome back to Epi Fridays. All right, today's topic is intersectionality and why it may be one of the most important public health concepts you've never fully learned. Most people hear the word intersectionality and immediately think diversity, inclusion, or identity politics. But intersectionality was never meant to be a buzzword. The term was coined by legal scholar Kimberly Crenshaw to describe how Black women were being overlooked when systems only examined race or gender separately. Because if you're only looking at racism, you can miss sexism. If you're only looking at sexism, you can miss racism. And if you're experiencing both at the same time, your reality can disappear entirely from the conversation. That's what intersectionality helps us see. In Epi, we often study factors that influence health one at a time, right? So income, education, neighborhoods, race, gender. But people don't experience these things separately. We experience them simultaneously. A Black woman navigating healthcare isn't just experiencing things based on her race. She isn't just experiencing things based on her gender, but she may also be experiencing the effects of where she lives, what resources are available to her community, her work environment, her responsibilities, and countless other social factors that overlap and interact. And intersectionality asks us to stop looking at those influences in isolation and start looking at how they work together. In fact, intersectionality was one of the frameworks that I used in my dissertation research, because when you're studying health among Black women, you very quickly realize that single factor explanations rarely tell the full story. The question isn't simply what affects health, the question is what happens when multiple systems of advantage and disadvantage collide at the same time. That's where some of the most important public health insights emerge. If you've been watching Epi Fridays, you've already seen intersectionality in action. When we talked about burnout, we weren't just talking about stress. We were talking about the expectations placed on Black women at work, at home, and in our communities. When we talked about the beauty industry, we weren't just talking about appearance. We were talking about how race, gender, economics, and cultural norms influence health behaviors. When we talked about voting rights, we weren't just talking about elections. We were talking about how power shapes access to the conditions that make health possible. You see where I'm going? And when we talked about being seen versus being recognized, we were talking about what happens when people's experiences are acknowledged but not fully understood. Those are all intersectional conversations. The more I've studied Black women's health, the more I've realized that some of our biggest public health questions can't be answered by looking at one factor at a time. That's why intersectionality matters, right? It gives us a framework for understanding how multiple identities and systems overlap to shape people's experiences. Because people don't live one issue at a time. Health doesn't happen one issue at a time, and Black women's lives certainly don't happen one issue at a time. It's about how all of our realities overlap and shape what we experience every single day. And when we as public health professionals fail to examine those intersections, we risk missing the very people we're trying to understand. Intersectionality didn't just give us a new word, it gave us a better way to ask questions, to conduct research, and a better way to understand Black women's health. Because if we want better outcomes, we first have to see the whole picture. And that's epidemiology, my friend. All right, y'all, that is this week's Epi Fridays. I hope you enjoyed. I'll see you next week. Bye.